Hello everyone. I want to make another video to update you from my last video, show you my progress. I finally got all my staples out, thank goodness. Oh, those things hurt and sting, and finally got them out. And a little over a week ago, I've got my chemo port put in. For the ones that already have it put in, you know what I'm talking about. But the ones that haven't started chemo yet, right after your surgery, so you'd know they go in for the second surgery, and they put in a port in your chest. You got a tube that runs up, and they have another. They cut right in here, and they insert the needle directly into your vein, so it stays there. And I've had since then. I've had my first round of chemo, trying to get used to it. So I go in for 1 4 hour treatment. They give you 2 bags uh, of nausea medication, and then they put my 2 hour bags on. It's two of them side by side. They put them in simultaneously, and you after those bags are empty, then they go ahead and remove it, and now they go to the pump. They have two different kinds of pumps. One was a CAD, which would be a like a motorized pump. The other one was a elastometric. That's the one I'm using. And for those that don't know what it is, it's basically like an elastic chamber, and it's filled with the actual chemo, and it's under pressure, so it's about the size of a tennis ball. And they give you a belt, kind of like a pouch around with a zipper, and you go ahead and you put the bag inside that zipper. Then the tube comes out of that pump, goes underneath your shirt, comes up, ties right into your chemo port. Has to stay there, and it's slowly putting the chemo into your system, directly into your vein, for 46 hours. And then I had to go in like 2 days later after that 46 hours, and they had to show the people that would maybe be helping me to be able to remove it at home, so I don't have to just keep going in and making all these trips. It's like an hour there, an hour back. So after the 46 hours, be able to flush the system with the saline, and then remove the port, put a band-aid on it, and then you're good for uh, another week. I have to do it every other week, and for 6 months. And it took some getting used to. Before I started the chemo, I was reading through the side effects, just like 4 pages of side effects. Uh, One I noticed on my first day home with the pump was like my arms, like my bones in my arms would kind of sore. My legs were aching. I took a couple Excedrin and made that go away. A little bit lightheaded. That went away. The main thing is you can't drink anything cold, or even just cool. I take a drink and it burns your mouth, and you swallow it, burns your throat on the way down. And what I understand, if it's too cold, it can, I don't know if it like a not really a hypothermia, but it can cause your body temperature to drop drastically. And one thing I didn't mention on my last video, I was telling you in this span of time between like July and April, when my before I had the surgery, my blood pressure had shot up to like 150 over 97, and it was like that for a few months until I had surgery. And I had surgery on April 5th at night, between 9 and midnight. From time surgery at night until the next morning when I got up and they did my blood pressure had dropped back down to 120 over 66, and it had been 150 over 97 for months. The next morning after the surgery, it's right back down to normal again. So this tumor that was in here, like I said, it was the size of a baseball, and apparently it was pushing on the arteries and the blood supply and making my heart overwork. And it right back down to normal. In fact, now uh, they told me when I got out of the hospital, they could go. They told me I could go ahead and resume my regular little 5 milligram blood pressure medication. I had to stop taking that little 5 milligram blood pressure medication because it dropped my blood pressure down. It was uh, 90 over 61. So I just cut that blood pressure medicine out altogether. I don't even need it anymore. So that's looking good. And uh, since my surgery, they've done uh, my my blood, checked my blood. My blood has come back clear. They've done my CAT scans of my chest CAT scans. They've done abdominal CAT scans. So far, it shows no trace of cancer anywhere else in my body. So they're thinking they had caught it early. Hopefully they have, but I have to go through the chemo to make sure it doesn't come back. Going every other week for 6 months, and then after 6 months, they will start testing me to find out how well the chemo treatments have went through. Um, for those that haven't started chemo, some of the side effects, there's so many of them. Um, Besides uh, killing out the bad cells in your body, it also attacks like the bone marrow, and where your bone marrow is responsible for producing your red and white blood cells. So they will be monitoring it on each treatment, and if my numbers go down, then they give you an additional shot that forces your bone marrow to produce more um, white and red blood cells to bring your numbers up. So the whole time you're in chemo, they're just going to be constantly checking and doing scans and everything else. So hopefully this doesn't come back. But the when I was first hit with this, I was like, oh my gosh, is my life over and everything? And it wasn't so much that I was concerned about myself. I was really concerned about, being there for my family, not just my daughter and, my parents, and everybody in my family, because my family pretty much can counted on me. If they needed help, they could just call, and I was just there in a split second. And that was the big thing, was worried about not being there for my family and being able to look out for my family. So there's a lot of things I know it's probably going to go through people's minds, worry and everything, and that's the whole reason behind this channel. Um, I'm reaching out other patients that are going through there. They'll also reach out. So I mean, don't hesitate to comment down in the comment section and ask questions, because you're not alone. There's a lot of us out here, and we care about you. So just 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 know that, and I will keep you updated on my future treatments. So until then, hit that thumbs up, and maybe subscribe to my channel. I'd love to have as many subscribers as possible, and we'll catch you on the next video.